What your nails say about your health. Have you ever looked closely at your nails and wondered why they sometimes change color, develop lines, or become unusually brittle? Most people think nail problems are just cosmetic, maybe dry weather, nail polish, or simply getting older. But doctors know something interesting. Your nails can actually reveal important clues about what is happening inside your body. In fact, long before modern medical tests existed, physicians often examined a patient's nails as part of a routine health check. Why? Because nails grow slowly and reflect changes in your body over time. Nutrient deficiencies, circulation problems, hormonal changes, and even certain illnesses can sometimes show up in your nails before other symptoms appear. And yet most people ignore these signs completely. They cover them with nail polish or assume it's nothing important. But your body is constantly sending signals, and your nails are one of the places where those signals can become visible. For example, have you ever noticed small white spots on your nails? Many people believe they appear because of a calcium deficiency, but surprisingly, that's not usually the real reason. Or maybe you've seen vertical lines running from the base of the nail to the tip. Are they harmless signs of aging, or something your body is trying to tell you? And what about nails that break easily or split? Sometimes the cause is external, like frequent exposure to water or chemicals. But in other cases, brittle nails may signal nutritional imbalances or problems with thyroid function. Even nail color can provide clues. Healthy nails usually have a light pink color because of the blood flow underneath the nail bed. But when nails become pale, yellow, or even slightly bluish, doctors may start asking additional questions about circulation, lung function, or vitamin levels. This doesn't mean every nail change indicates a serious health problem, but it does mean your nails are worth paying attention to. Because sometimes small visible changes can reflect bigger processes happening inside the body. Before we continue, if you enjoy learning simple ways to understand your body and improve your health naturally, make sure to subscribe to the channel. We share science-based health tips every week to help you stay healthier, stronger, and more informed about your body. Now let's take a closer look at some of the most common nail changes and what they may mean. One of the most common signs people notice is vertical ridges on their nails. These thin lines running from the base of the nail toward the tip are extremely common, especially as people get older. In many cases, they are simply a natural part of aging. As the body ages, nail growth slows down, and the nail surface can become less smooth. Then in some situations, more pronounced ridges may be linked to dehydration or nutritional deficiencies. Your nails are made primarily of a protein called keratin, and proper nail growth depends on nutrients like iron, zinc, biotin, and protein. If the body doesn't receive enough of these nutrients, nail texture can change over time. Another common change people notice is white spots on the nails. These tiny white marks can appear suddenly and then grow out with the nail over time. Despite popular belief, they are rarely caused by calcium deficiency. In most cases, white spots appear because of small injuries to the nail matrix, the area where new nail cells are produced. Even a small bump or pressure on the nail can cause these marks. However, when white discoloration covers a larger part of the nail, doctors may sometimes investigate further. And there is one nail change in particular that many doctors pay close attention to, because it may signal something happening with your circulation or oxygen levels. And in the next part, we'll talk about that sign and what your nail color might reveal about your health. Nail color changes, what your body might be telling you. Now let's talk about one of the most important clues your nails can give you, their color. Healthy nails usually have a light pink tone. This color comes from the blood flow underneath the nail bed and often reflects healthy circulation and oxygen levels in the body. But when the color of your nails changes, doctors sometimes pay close attention, because nail color can occasionally provide hints about what may be happening inside the body. For example, very pale nails may sometimes be linked to low iron levels. Iron plays a key role in producing hemoglobin, the protein in red blood cells that carries oxygen throughout the body. When iron levels are low, the body may produce fewer healthy red blood cells, and the skin and nails may appear paler than usual. People with low iron levels may also experience symptoms such as fatigue, weakness, or feeling cold more often than usual. However, pale nails do not always mean anemia. Lighting conditions, dehydration, or even nail polish can sometimes change how nails appear. That's why doctors always look at the whole picture rather than relying on one sign alone. Another color change people sometimes notice is yellow nails. In many cases, yellow nails are simply caused by nail polish staining or smoking. But when nails become thick, slow-growing, and deeply yellow, doctors may sometimes consider other possibilities. Certain fungal infections can cause nails to become yellow and brittle over time, and in rare situations, persistent yellow nails may be linked to conditions that affect the lungs or lymphatic system. Again, this does not mean yellow nails automatically indicate a serious illness, but if the change lasts for a long time or is accompanied by other symptoms, it may be worth discussing with a healthcare professional. Another nail color that doctors sometimes pay attention to is bluish or slightly purple nails, because this color may suggest that the blood under the nail is not receiving enough oxygen. Low oxygen levels can sometimes occur in people with circulation problems or certain heart and lung conditions. However, temporary blue nails can also appear simply from cold temperatures. When the body gets cold, blood vessels in the hands constrict, which can temporarily change nail color. Once the body warms up, the color usually returns to normal. There is also another interesting nail change that many people notice as they get older: nails that become very brittle and break easily. Many people assume this is simply a cosmetic issue, but brittle nails may sometimes be related to dehydration, frequent exposure to water or cleaning products, or nutritional imbalances. For example, low levels of certain nutrients, such as biotin, iron, or zinc, may influence nail strength. The thyroid gland can also play a role. Thyroid hormones help regulate metabolism throughout the body, including the growth of hair and nails. When thyroid function becomes unbalanced, some people may notice changes in nail texture or strength. Of course, none of these nail changes alone can diagnose a health condition, but they can serve as small clues that encourage people to pay closer attention to their overall health. And sometimes the body gives us subtle signals long before more obvious symptoms appear. But there is one nail change that doctors often consider especially interesting, because it may sometimes reflect changes in nutrition or the body's ability to produce healthy blood cells. And that sign appears in the shape of the nail itself. In the next part, we'll talk about nail shapes, nail thickness, and one unusual nail pattern that doctors sometimes look for during medical exams: nail shape and texture, hidden signals from your body. Now let's look at another important detail doctors sometimes pay attention to: the shape and texture of your nails. Most healthy nails have a smooth surface and a slightly curved shape. They grow slowly but consistently, and they remain relatively strong. But when the shape of the nail begins to change, it can sometimes provide additional clues about what may be happening inside the body. One nail shape doctors occasionally notice is called spoon nails. In this condition, the nail becomes thin and curves slightly upward, almost like a small spoon. Instead of being gently rounded, the center of the nail may appear slightly hollow. This condition is known as koilonychia, and it has sometimes been associated with low iron levels. Iron plays a key role in transporting oxygen through the blood. When iron levels become too low, certain tissues in the body may not receive the oxygen they need. In some people, this may eventually affect nail growth and shape. However, spoon nails can also appear in people who frequently expose their hands to water or chemicals, so context always matters. Another nail pattern doctors sometimes observe is thickened nails. When nails become unusually thick, hard, or difficult to trim, the most common cause is a fungal infection. Fungi thrive in warm and moist environments, which is why nail infections often begin on the toenails. Over time, infected nails may become thicker, discolored, and brittle. Fortunately, many fungal nail infections can be treated with proper medical care. There is also a very unusual nail change known as clubbing. In this condition, the tips of the fingers become enlarged and the nails curve downward more dramatically than usual. Clubbing is relatively rare, but doctors are trained to recognize it because it may sometimes be associated with certain lung or heart conditions. Again, this does not mean that every unusual nail shape indicates a serious disease, but medical professionals learn to observe these patterns because they can occasionally provide useful information during a physical exam. Your nails grow slowly, usually about 3 millimeters per month. Because of this slow growth, changes in your nails may reflect processes that have been happening in the body for several weeks or even months. This is why doctors sometimes consider nails a kind of biological timeline. They record small changes that may reflect nutrition, circulation, hydration, and overall health. But here's the most important thing to remember. Your nails alone cannot diagnose a medical condition. They are simply one piece of a much larger picture. Sleep, diet, stress levels, hydration, and lifestyle habits all influence how your body functions, and these factors can also affect the health of your nails. Maintaining a balanced diet rich in protein, vitamins, and minerals can help support healthy nail growth. Staying hydrated, protecting your hands from harsh chemicals, and avoiding excessive nail treatments may also help keep nails strong. And sometimes, simply paying attention to small changes in your body can help you notice when something might need closer attention. Your body communicates with you constantly. Through your energy levels, through your skin, through your hair, and sometimes through your nails. If you found this information helpful and want to learn more about the signals your body may be sending you, make sure to subscribe to the channel. We share new science-based health videos every week to help you better understand how your body works. And in the next video, we'll talk about 7 facial signs that may reveal hidden health problems. Signs most people notice but rarely understand. Because sometimes the smallest details about your body can reveal the most important clues about your health. 7 nail changes you should never ignore. By now you know that your nails can reveal small clues about your overall health. Most nail changes are harmless and simply reflect aging, lifestyle habits, or environmental factors. But there are a few nail changes that doctors recommend paying closer attention to. Let's look at several signs that may sometimes indicate that the body needs more attention. The first sign is dark lines under the nail. Sometimes these lines appear after an injury, when a small blood vessel breaks under the nail. In most cases, the mark slowly grows out as the nail grows. However, if a dark line appears suddenly and does not move with nail growth, doctors may sometimes recommend having it checked. This is rare, but changes in nail pigmentation can occasionally require further examination. Another sign is horizontal lines across the nail, sometimes called Bow's lines. These lines appear when nail growth temporarily slows or stops. This can sometimes happen after illness, high fever, severe stress, or major changes in the body. Because nails grow slowly, these lines can act like a record of events that happened weeks earlier. Some people also notice very slow nail growth. Normally, fingernails grow about 3 millimeters per month, but when nail growth slows significantly, it may sometimes be related to circulation, aging, or metabolic changes. Another change people often notice is very fragile nails that peel in layers. This condition is sometimes called nail splitting. Frequent hand washing, cleaning chemicals, and dehydration are common causes, but in some cases, nutritional imbalances, such as low iron or low biotin, may also contribute. There is also a condition known as pitting, where small dents appear across the surface of the nail. These tiny depressions may sometimes be seen in people with certain skin conditions, such as psoriasis. Again, this does not automatically mean someone has a disease, but doctors sometimes consider nail pitting as one of several possible clues during diagnosis. Another noticeable change is swelling around the nail bed. Redness, pain, or swelling around the nail may sometimes indicate an infection or irritation. Bacteria and fungi can enter small cuts around the nail and cause inflammation. This is why keeping nails clean and avoiding damage to the cuticle area is important. Finally, there is a sign many people overlook completely. Half-white nails, where the lower part of the nail appears darker, while the upper part looks pale. In some cases, this nail pattern has been associated with changes in kidney function or other metabolic conditions. However, nail appearance alone is never enough to diagnose a health problem. Doctors always consider many different factors when evaluating a patient's health. But learning to observe small changes in your body can help you become more aware of your overall well-being. Your nails may seem like a small detail, but they are actually part of a complex system that reflects nutrition, circulation, and cellular health. Sometimes the body sends subtle signals long before larger symptoms appear, and paying attention to these signals can help you take better care of your health. If you found this video helpful and want to learn more about the hidden signals your body may be sending you, make sure to subscribe to the channel. We post new science-based health videos every week that explain how small changes in your body can reveal important health clues. And in the next video, we'll talk about 7 facial signs that may reveal hidden health problems, signs that millions of people notice every day without realizing what they might mean. Because sometimes your body is trying to tell you something important, and you just need to know where to look.